My name is Albert Saga. I'm the Chief School Health, Nutrition, HIV and AIDS Officer in the Ministry of Education in Malawi. I coordinate school health, nutrition, HIV and AIDS programs in the country.
Thank you so much, Mr. Albert Saga, for joining us in this discussion of COVID-19 and education. What was the government of Malawi's response to COVID-19?
The government of Malawi responded to COVID-19 just like many governments globally. The government developed guidelines that guided all the sectors on how to respond to the COVID-19. So within these guidelines, the focus was on making sure that all people are wearing masks at all times, but also everyone is washing hands with soap at all times, but also everyone is keeping social distance, because these were the main areas of how the COVID-19 would be prevented and mitigated. But also the schools were closed when the cases started rising, because the aim was to cut transmission from affecting teachers and learners. But also at the same time, the school feeding program was also stopped. Because we used to prepare the meals in schools. So when schools closed, the school feeding program was also closed. And the school feeding program has a number of partners, one of them being Nascent Solutions that works hand in hand with government. But also on the same, the government made sure that more people were working from home, so that within the offices there were supposed to be few people in order to cut the transmission.
How did the government of Malawi ensure the continuity of education during lockdowns?
The government of Malawi made sure that teaching and learning continued even though schools were closed, by making sure that there were radio programs on air. So within the Ministry of Education, departments produced programs that were aired on various radios. So the aim was to make sure that learners are still accessing education even though they were on holiday. Also, the ministry started online classes where learners would go online and be able to access the content from the website for the Ministry of Education. But also there was a promotion of advocacy in the community, where the government was working hand in hand with various NGOs, including Nascent Solutions and Save the Children, and others, to make sure that this still continuation of learning taking place through encouraging the parents to continue assisting the learners through home reading. But also the ministry started implementing the shifting, the double shifting, where all teachers were teaching all day in the morning and afternoon, and the aim was to reduce class size so that each teacher had a smaller number of learners to attend to. So this was aiming at improving the teacher-pupil ratio. But also the government recruited auxiliary teachers to make sure that there were enough teachers, because now the classes were more as compared to previously. But also the government changed the modality for the school feeding program from hot meals in schools to take-home ration, where the parents were being given food products from the schools, but then they were encouraged to prepare the meals at home, where learners would be taking the meals and accessing education through radios and online. But also the curriculum was reviewed to include issues to do with COVID-19.
Were there shortfalls to the actions the government of Malawi took to ensure the continuity of learning?
Yes, there were shortfalls, of course. Firstly, as you might be aware, that most people in Malawi, especially those that live in the rural areas, are poor, and therefore some of them could not afford radios, and therefore that meant their children couldn't access these radio programs. But also in Malawi, internet is a bit challenging, so therefore, even though the courses were put online, but not all the learners could be able to access them. When the schools closed, both the schools closed for 4 or 5 months, and during that period, most young girls got pregnant. So this was also a big blow to the education sector. And also, during the same, as I mentioned earlier, to say we changed the modality of the school feeding program, where we are now giving the food to the parents to prepare the meals at home. So instead of the food being targeting just one child, the parents were able now to share the meals with the rest of the other household members, and this affected the main objectives of the feeding program. But also the school calendar was affected because of the long closure of the schools during the time the schools were closed.
What is the government of Malawi doing now to help Malawians recover from the pandemic in the context of education?
The government has developed COVID-19 guidelines by all sectors to be followed, and also by the Ministry of Education to follow as well. And then the schools were reopened, and amongst those guidelines, the other aspect was on promotion of, resumption of the wet school feeding, where schools and with the support from our various partners resumed the cooking of meals in school. So therefore we had to develop guidelines to guide implementation of the program during the period that we are in, the COVID-19 pandemic. But also the government continued recruiting more teachers to make sure that the class sizes are reduced, like I mentioned earlier on. But also government is continuing building more classes to make sure that the class sizes are reduced, so in order to enable the teachers to be able to teach smaller classes. Also, the government is continuing promoting vaccinations, where it's encouraging all members of the everyone in the country to make sure that they get access to the vaccines. Thank you.